Hello and welcome to the Faith and Culture to Your Health. We are here again, and I feel so blessed to be speaking with the incredible, internationally known Dr. Judy Mikovits. And you might be wondering why I'm pushing all of the health shows. And it's because God wants us to be healthy, and our health system has become very, I guess, taken over by greed and big corporate ideologies. So it's harder and harder for people to actually stay healthy. I just want to read something very quickly out of the book of Revelation. If you go to Revelation 18:23, God warns that in the very last days, he says, the light of a lamp will never shine in you again. The voice of bridegroom and bride will never be heard in you again. Your merchants were in the world's important people. By your magic spell, all the nations were led astray. And when the original in the Greek, it says pharmakia instead of magic spells, because they saw pharmakia, pharmaceuticals, sorcery as magic spells, because they weren't natural. And that's why we are going to start a series here with Dr. Judy to talk about today's pharmaceuticals, because we see them on every programming, on television, on the internet. You can't get away from them. And Dr. Judy is going to inform us why this is happening and what they're doing. So for those of you who don't know Dr. Judy, and you're going to get to know her, I want to give you a little bit of background. She's an innovative cellular and molecular biologist. She's a biochemist with over 44 years of scientific expertise as a Ph.D. in life sciences, including planning, directing, and implementing programs in HIV, cancer, epigenetics, neuroimmune disease, with a focus on development of novel drug and diagnostic technologies. She has demonstrated leadership in introducing and establishing new programs and technologies efficiently, organizing and standardizing processes, and effectively managing multiple projects and personnel. She is solution-oriented. She's a team player with strong supervisory, project management, and problem-solving skills. She has an ability to build solid multicultural teams within startup and changing environments. She has demonstrated the ability to foster strong relationships with strategic partners, collaborators, cross-functional teams, and in the realm of science. So, Dr. Judy, I can't tell you how excited I am to get started with this series on pharmacia, pharmaceuticals. And we're doing this because we know what's happening is wrong, and that everyone's lying to us, and that's not from God.
No.
God does not lie, and he wants us to be healthy and our best selves so that we can serve the kingdom of God. And Judy's doing a great job of doing that. You're traveling all over the place. You're involved in so many projects that are helping people, and it's very exciting. So before we get into it, do you want to say anything?
Oh, sure. Well, yeah. So what's fun about it is I always want to say something. The pharmakia with a PH is also like nutraceuticals. And where did that come from in our world? Oh, because somehow we started genetically modifying foods, and the genetically modified foods, GMO. God didn't need help. And so now we have an issue in our country that Maha, Make America Healthy Again, is trying to address. And that's that, it's not your grandmother's spinach. Your food, because of a soil that's killed, because of herbicides, you're simply not getting nutrients. You're simply not getting. So nutraceuticals are just as bad as pharmaceuticals, and they're synthetic and genetically modified, and they don't heal us. So what happened back in 2012, 13 is then President Obama said, okay, or maybe it was after his time, I don't know who was president, but 12, 13, he brought back the Propaganda Act. Act. And what that said is that government sponsored materials, education. I'm an educator. A PhD is a professor. I teach how to do the things that we developed. And that's another great thing about Bobby Kennedy. He announced last week that now medical schools are going to require, 40 hours of nutrition. Well, we don't have nutrients because our food is toxic and modified. So it's about God and not government. We're one nation under God in each person's sovereign body. So now what we're going to do a little bit in this series is show you how some of that propaganda, I think the worst thing for people, I thought I'd start with these so-called public health commercials and these pharma commercials or these nutritional supplement commercials. We didn't need supplements. We need nutrients and we need food, but unfortunately 98% of our food supply is not food at all. It's genetically modified, and we don't appreciate when we're watching these commercials. So as an educator, I thought this series would be fun because people are like, well, what about GLPs and what about snake venom and what about, so if we go there and we break down to what they're showing you and what they're saying, we then learn, I'd like to call it a biblical discernment. Because knowledge is not information, and to produce knowledge and communicate knowledge is a scholar's obligation. A PhD is a scholar with a philosophy from the institutions where they were trained, and I was blessed to be trained at our founding father, Thomas Jefferson. He's the scientist among your founding fathers. Benjamin Rush is the physician. So we don't call it doctor, and you don't say physician heal themselves. So a doctor is a teacher, but where your doctorate, where your information comes from, is your training. But unless you have experience, like all you just said in the bio, yes, you have to go translate the knowledge into changing the way medicine is practiced. So my PhD in 1991 changed the way we would treat an NHIV infection such that Magic Johnson never got AIDS. And so people now can live with the infection. The infection is not the disease. So we have to be very careful to think about the protection God gave us and use a systems biology approach. So it's fun. And I think it'll be fun for you to see this because you're going to see how you're being lied to, but the propaganda and is it's on you to be a discerning Christian in our cases, but a discerning individual, so that you can look and we can describe what happens when you ask your doctor in the terms they use. So why don't we get going and start with that first commercial? And I mentioned this a few weeks ago, so I haven't seen these lately, so it'll be kind of fun. It'll be
Okay.
really fun.
And before we get to that, I just wanted to say I didn't realize somebody that we both know and love. When I told her we were going to do this series, she said that this when they have these pharmaceutical commercials and you go to your doctor and ask them for that drug, then they assume that you already have knowledge, that you already have, it's like giving them consent to give it to you. Is this
Yeah,
right?
well, that's exactly right. But it's worse than that. They're not assuming. So what they'll do is when you go to your doctor, they'll number one, blame it on your behavior. And they don't know what they're talking about. So in fact, because they've never been educated, they've never been educated, no nutrition whatsoever. So when you ask your doctor if it's right for you, you are actually agreeing to participate in a clinical trial. Nothing on a TV commercial has ever undergone the kinds of clinical trials that we had to do in my 46-year history of how you develop a therapeutic and what it takes. And we're blessed now that we know that from whether it be Senator Ron Johnson or the High Wire, where we both learn with Del Bigtree, where we learn from Jeffrey Jackson, where we learn where the propaganda is in the medical literature. I didn't say scientific literature, because science is not medicine. Science is science. Gravity is gravity. If you jump out of the plane, you'll experience that. If you don't have a parachute, the laws of nature are science. And that's where
Wow.
it's interesting. So you're exactly right, because it's
Wow.
not only propaganda, but you're consenting. You
Mhm.
literally, and the doctor has no idea. And so if he can't give you informed consent, so when you agree to take that free sample and you take that home and you try it, when you ask your doctor if it's right for you and they give it to you, you're participating in a clinical trial. And
Wow.
you are assumed to have been informed, and you haven't been. So that's what we'll teach you today.
Yeah, and I also, Judy, this is surprising because I also know a pharmacist who works at a hospital, and that's been his career. And he looks at these commercials and says, "I've never heard of half of these
Oh,
drugs."
I will tell you that in 2009, when our paper came out on the XMRVs, that
Mhm.
Xeno, that's foreign mouse monkey manufactured mRNA from all kinds of viruses, coronaviruses, retrovirus, when I'm sorry, those viruses, when it's literally xenotransplantation program was started at the NCI by Harold Varmus in 1999. So why are xenotransplantation called vaccines, okay, or immune therapies? So you don't know the names of those, because when our paper was published, they were criminally liable and economically liable for every injury. And we won that in HIV/AIDS. So that if you make less than $72,000 a year, why don't I just say in the state of California,
Yeah.
then the government has to pay for your HIV infection, all your treatment, all your detection. So they don't want you to know that, and many don't. So in fact, it is far more sinister. Sinister, I use that word on purpose because it's Satan. I'm
Mhm.
delighted that you read Revelation, because here at Dayspring Church, Pastor Rick Brown talked about Revelation 15 yesterday, and the whole idea of what we should and shouldn't say and when God's talking to. So yeah, you're exactly right. Not only, this was intentional. And so it was an intentional pandemic. They're criminally and economically liable for all the injuries, because SARS-CoV-2 is an XMRV. And so when they couldn't in 2009 use these components, these aluminums and polyethylene glycol, and the animal cell lines, most importantly, monkey, mouse, cow, aborted fetal, looking at all the animal cell lines in other classes that I've taught, several on our immunization classes on our cover already there. They were criminally liable. So what did they do with those drugs? They call them biologics. So they're still selling them to you. And so that they can now obey the 1986 Act and put the actual lot numbers on your immunization record. Everything we've been teaching you, so what did they know and when did they know it? Well, it's your
Mhm.
Congress that is criminal, not your doctors. They were absolved, not pharma. And I say, not your MDs, not your practitioners. And you'll see these words in the commercial. So no, you've never heard of any of them. And I sit and watch them at night for fun. And I can't. And so they're all called monoclonal antibodies. When you see the MAB at the end of the word monoclonal antibody, and they call them humanized. Well, humanized ain't a thing. And human isn't a word in the Bible, it's man and woman. And I love folks like, as we're talking about other disease communities, these are all chronic diseases, not acute diseases. Can we use something acutely for a short period of time upon a foundation of healing? Yes. You have to put a tourniquet on it to stop the bleeding. But at the end of the day, oh, you'll be on this drug for the rest of your life. No, you won't. And so I've been fighting that, as you know, since I was a small child. And so you're exactly right, because in 2009, they've got to kill everyone with these biologics, because you don't think they were going to throw away all those vaccines that our paper said, no, 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 no more monkey, no more mouse, no more cow. Look at all the variants in our papers and our patents from 2010, from our work that we developed from 1980 through 2001, when I went to two small pharmaceutical companies in Santa Barbara, California, and the University of California, Santa Barbara. We were blowing it away on innovation. Yeah, Americans and what did they do? They destroyed small business. That was the goal, so that the big conglomerates could control, and you lose innovation. That's the United States of America. People who are free to think and challenge paradigms, but we couldn't have a conversation. So it was the censorship and the corruption in the journals. No medical journal, JAMA, Nature. Science was science. They had to publish that paper. But the reviewers of that paper took all of the immunology data out, all of it. And therefore, they just created chaos and division among the scientists who deliberately got paid not to reproduce your methods. And therefore, you didn't reproduce it. And so that doesn't matter anymore, because we never stopped doing it. And now, thanks to Trump Kennedy, we're going to have the opportunity to clean up our land, to clean up our soils, to stop injecting our animals, to stop the genetic modification of crops. No, 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 no. A flavor saver tomato is deadly. I mean, they're thin skinned, right? They look pretty on the outside and they squish in your. No, we need all the microorganisms that God gave us. Why do you think Noah took everything on the ark? So we're always going to go back to God, because we're one nation under God, not one nation under government, with liberty, not freedom, with liberty is God's idea, and justice for all. Justice for all means the pursuit of happiness, life, liberty, and the pursuit of happiness. Well, in vitro fertilization is sterilization. Oh, okay. You can't force that on people, but we have, a world of Christians that are sterilizing themselves without that knowledge. And that's why we teach. That's why we teach, because it's not okay. RU 486 wasn't the morning after pill. And now they're pushing that in Congress. What do you do when your entire Congress, you saw them sit down, are captured? They're captured by
Yes,
pharma. They're
they are.
captured. They're not controlled opposition. They're captured by Satan. They're
Yeah.
captured. They're
It
captured.
boils
And
down to that. Yeah,
yeah. Mhm.
they are.
So who's your daddy?
Ah, the
There's
Lord.
only one. Because that Jesus Christ, my Lord and Savior, and my
That's
daddy.
right.
Abba, Father. Help.
Yes. Okay, so we're going to do the first one that you talked about, which is Dupixent. Did I say it right?
Dupixent. Yes, I don't think there's
Dupixent.
an IE in it.
Okay, Dupixent. All right, let's take a look at the
All right.
commercial, and then you can tell us what's going on here.
Yeah, we'll slow it down. Okay, if we stop right there, or we just sit on the lane, here's what you see very quickly. So
Okay.
you see Dupixent is dupilumab. So again, dupilumab. Okay, and it's an injection because the point is they have to inject it in order to get it to. So it's for people 6 months of age. No, 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 no. Those are children, and they're protected. Those children are protected. You can't inject something in a child's immune system at 6 months of age without clinical trials. Remember, but they're saying that in vaccines, they call them immunizations. They are not. In vaccines, that you can't do a study. You can't do a study in a 6 month old because it's it's unethical. It's unethical is what they say. Okay, so for people of 6 months of age and older with moderate to severe eczema. Oh, well, eczema, atopic dermatitis. What is atopic dermatitis? Oh, that's the number one vaccine injury every kid gets. Atopic dermatitis. And again, I'm also speaking what we didn't read in my bio is in 2013, I became Mark Inc., my company, Mikovits and Rossetti Consulting, my boss and I, my mentor, Frank Rossetti. Mikovits and Rossetti Consulting were adjunct professors at the George Washington University Vaccine Injury Law Clinic. So what did I do? So we told you these injuries at the molecular level. And so we told doctors, we taught the special masters. That's the biggest moronic, it's corrupt. It's so corrupt. Some special master, he's not even a judge, not a biologist. And literally the vaccine is innocent at all costs. And what they do to these kids, we did it for almost 9 years before COVID, and they shut that down. That program, 1986theact.com, is the movie. That's where you find the movie, 1986theact.com, that shows you that corruption right down to my second favorite environmental lawyer, Michael R. Hugo. There's no such thing as turbo cancer. Okay, so here's Dupixent. Atopic dermatitis, not well controlled with topical prescription RX therapies, who cannot use those therapies. Well, a 6 month old doesn't get to decide if they can use those, or a child, so who's deciding that? Okay, so let's see what that actually is.
Okay. Just let me know when you want me to
Go ahead
pause
and
it,
play,
okay?
and
Okay.
yeah, we'll watch.
Even if you have moderate to severe eczema, you can feel the rhythm, feel the flow, and Dupixent helps you feel the heal. It helps calm the key source of inflammation under the skin that can cause eczema. Some adults saw fast itch relief after the first dose, and long-lasting clear skin at 1 year. Many even saw 90% clear skin. Severe allergic reactions, including skin reactions, can occur. Get help right away for face, mouth, tongue, or throat.
Stop there. Okay.
Okay.
So what did we hear? So we heard that Dupixent was for atopic dermatitis. Well, in COVID, Dupixent was for COPD. Ooh, how'd you kill everyone? Anyway, so severe allergic reaction. Oh,
Yeah.
allergy. What does that look like? That's not a thing, by the way. Allergy is not a scientific term. It's you trying to vomit out, puke out, get out of your skin the poisons that were injected into you. That's your body and your biological responses trying to get rid of the poisons, your immune system. That's what it does. That's what we teach. Okay, severe allergic reactions, including skin reactions. Okay, you're taking this for people who have failed other prescription ointments creams on your skin, which are poison. Let's think about COVID. Hand sanitizers, deadly, deadly, deadly. Stop it. Petroleum. So what did you do on your skin? You didn't get vitamin D. We've used sunscreen for 40 years. Oops, that's petroleum. That's your industry, that is the MD. Okay, they can occur. Well, you're using this drug to an injection to fight a skin reaction, atopic dermatitis. What did they say? Feel the heel. They're all dancing around. And what's the heel? It's itch. But you didn't hear any science in any of this. You heard itch. Well, what is itch? Itch is TRPV1. What is that? Trans receptor potential. It's molecular biology. It's a sensor on your cells. And when something itches, you scratch it. And autistic kids, because of TRP, they get atopic dermatitis years before they get the autism. If we can teach doctors through Vaccine Injury Law Clinic, as we hope to teach again as professors, as we were up until 2019 when they knew we caught them and they cut us all off again. So we can get help right away for face, mouth, tongue, or throat swelling, wheezing. Oh, because Dupixent was used for COPD. And it was, again, it's toxic, it's deadly, it's not anything that should have ever been given to anybody. Could we help people with it? Yes, and we did in those late times in the hospitals at a certain amount of time because we backfilled with the nutrients. So here they're playing volleyball. So itch is what you're feeling, the heel. You stop itching. These kids would put holes in their skin. You know what an itch that you can't scratch is like, and they can't communicate. What does a 6 months old know? They can't communicate. Okay, TRPV1, trans receptor potential, vanilloid across the membrane of charge. That's all that means. That's molecular biology, plus and minus. So you're gonna have trouble breathing. You're gonna die of COVID, and they already injected you with all this stuff anyway. That's what COVID was. They had to premeditated murder, RICO, racketeering and conspiracy by Congress and pharma, NHHS, who played right along in this criminal court called Vaccine Court. They disobeyed that law, euphemistically, of Barbara Loe Fisher and Michael R. Hugo back to 1988. Okay, next.
Okay, let's continue.
Continue.
Swelling, wheezing, or trouble breathing. Tell your doctor of new or worsening eye problems like eye pain or vision changes, skin symptoms, joint aches and pain, or a parasitic infection. Don't change or stop other treatments without talking to your...
So what have we all been talking about? Parasites. Oh, so then eye pain. Now we've all got dry eyes and we're injecting our eyes and you don't form tears. And we've got a class there with the beautiful Dr. Nanda on our cub because, of course, Cardio Miracle she calls ocular miracle. It's only powdered food that's cleaned of all the garbage that you can actually conduct the molecular reactions. But you need something else for the itch. And that's where you need to look at other nutrient pathways. Well, we've already done that. That's not a problem. Oh, so you don't change or stop other treatments without talking to your doctor. Well, but if you're taking something else, you could literally have sudden adult death and die from this. And all they're showing you here is fit, young, dark-skinned men and women. They don't show you the worst of it in these babies, which I don't want to show you pictures. So don't change anything without talking to your doctor. Well, fine. So if you go in there, don't ask him if it's right for you. Say, hey, you walk through this commercial like Dr. Judy and Kathryn do, and you show me what you know about the studies. Show me. We're from Missouri, the show me state. Because again, eczema, they're hiding the fact that it was used during COVID under the same name. So you just changed the name of the disease. Okay, so we'll continue on. It's only a few more seconds. So what have you learned from the commercial? Nothing. But wouldn't a teenager or somebody playing volleyball like to have clear skin? Wouldn't these people not like to have these horrible lesions where they're scratching their, and I get them all the time because of course I've been exposed to let's get the doctors, they deserve it. Melinda Gates, pandemic indoctrination. Oh, let's make sure the nurses and doctors get it so they can take it home to their children. Okay, next.
Mm.
It's
Wow.
bad. It's
It is
bad.
very bad. And yeah, very bad.
Well, we'll go through here then and hear it.
Your doctor. Stay ahead of eczema and help heal your skin from within. Dupixent, the #1 prescribed biologic by dermatologists and allergists. Ask
That's
your
the
eczema
key.
specialist about Dupixent today.
Okay, so you have a eczema specialist, ask them, stay ahead, help the heal. It didn't say heal. It said, and so listen to the words they use. Heal from the inside out. You mean we might actually hit the root cause? No, you won't. But it's the #1 biologic. Because that's the FDA. Okay, so were immunizations in the cow, monkey, pig, aborted fetal cell lines that were in every one of these shots that caused this? This is still an injection. So actually what you're going to do, you're already pathogenically primed, and that can actually kill you. And they know that. Your doctor doesn't know that because he's never been taught molecular biology. A lot of us have been censored out of the game, and you haven't been told the truth. So again, they come all the way back to for 6 months of age, and they basically lied to you. The #1 biologic prescribed. Who cares? Who cares if it's the #1 biologic? It's the #1 problem in all injury. When your hair falls out, it's a slightly different thing. But again, we saw all of these things and we opined as to how to stop this. So my goal here is to teach not only patients and people with these diseases. Notice how they're all young people.
Yeah.
Notice how most of them are people of color.
Mm-hmm.
Oh, because people of color were more susceptible to your injuries because they're eating glyphosate, and they're forced to eat glyphosate, and they're forced in many states like California, they're forced to get these shots. California lost its medical exemptions with SB 277. Oh, so 270, it's personal exemption. Medical was SB 276 in 2019. You're corrupt. New scum. We know, but what do you do about it? Because the food's all poison.
Yeah.
So we can re-back that up towards the end there and listen to what they tell you in the end. After they tell you all the things that can happen, all they say is it's the #1 prescribed biologic. How much money is that doctor making for that? And how much money is that company charging Medicare and WIC programs, women and children programs? How much money is that costing our government? Because health insurance, quit your health insurance. We don't owe my soul to the company store. Nope, it's not a benefit. Quit Medicare, opt out, because all you're doing is poisoning 6-month-old people. It's a child. They
Yeah.
can't consent for themselves. It's an infant. They don't need a pediatrician, before they go to school. They're not a patient. Birth isn't a disease. I mean, but this is the problem. We're not a patient from the time we're born. So that's that first commercial. The #1 biologic. Who cares? Your doctor's a criminal. He doesn't know what's in it, and all you have to do is file malpractice. So not a lawsuit. Walk in the door, say, okay, tell me about Dupixent for this thing. And you tell me everything that will do, and you explain every word Dr. Judy and Kathryn just said. And when he can't, say, who's your insurance? Who is your insurance? Your malpractice insurance. Ah, okay, thank you. And just go file a claim that this doctor was practicing malpractice. You're practicing without the knowledge, and you gave me false information, or at least you didn't know what that information is. Doesn't matter who's wrong, but you will bankrupt them. And as soon as you bankrupt them and they have to pay a lot of money to practice, they'll stop doing it. So we
Yeah.
have to have a positive action, and you don't have to be mean, just ask them what's
Mhm.
in it. And how does it work? I don't know what a MAB is. Walk into the development and production of dupilumab. I can answer that question. And so, I go with people and I play it. So does Great Care. Great Care will help you as well. So we've got systems set up so that you don't have to be afraid to talk to the medical deities. They don't have any choice. You have full informed consent, and it's up to you. So why don't we play the next one and see where we go?
Okay, let me set that up.
Unless you have any comments with that.
Well, I wanted to ask you to, I was explained one time by the veterinarian that we see what a biologic is. And
Mhm.
I want to hear it from you because we hear this a lot. It's a biologic. And okay, what is that? It sounds so innocent, it sounds pure, but I want to
Yeah.
hear from you before I
Well,
give my opinion on
a
what I was told.
biologic biology is any organism. Is snake venom peptides in Ozempic a biologic? Yes, it is. Is a monoclonal antibody, synthetic or otherwise, a biologic? Yes, it is. But humanized monoclonal antibodies might not be. Do you really want an antibody from a cow, a veterinarian? What is a biologic? It's any microorganism. It's biology. It's
Hmm.
nature. That's science, as I just said. So it could have been extracted from a worm. It can be genetically modified, but as long as it's called a monoclonal antibody, by definition, it's a biologic, because antibodies are our own immune system make that, but it's not mine. So, biology. Well, that's all of biology. That could be plant, animal. It can be, as long as it has carbon in it, oxygen, nitrogen, hydrogen. Again, the definition of a biologic from your FDA, your USDA, and your EPA and organic are three different things. Organic, according to the food you buy. They use definitions because scientifically they have to be correct. So scientifically, it's a biologic, but it's mRNA. Remember during COVID when I want the monoclonal antibody. Which monoclonal antibody?
Right.
That was one of the things they were giving you. Was that good for you? No. So it makes you think the lie is you think, oh, it's natural. No, it's not. Your criminal FDA is not going to change. Their goal is still to kill you because your Congress is treasonous and they got bought and paid for. I hate to give you the facts, but what do you think? What did your veterinarian say? Was it biologic?
She said that it was made from blood. And
Synthetic blood. It
okay.
sequences. It doesn't have which cow blood, pig blood,
Yeah.
mammal blood.
Do we really
Not
want that in
necessarily.
our body though, Judy?
No, but it's
Do we
not
want pig
necessarily made
blood?
from blood.
Yeah. I
We
mean,
don't.
even horse blood, because I know they were saying the monoclonal antibodies were made from horses because the horses are that they have something in them that keeps them from getting sick from snake bites. And so they
Well,
were trying to pass that on to humans, which, okay, but do I really want an animal's blood mixing with my blood as a human? You know, we're warned in scripture. It says, the life is in the blood and you want to keep it as pure as possible. So that's why I'm asking you.
it's mRNA. She's actually wrong. It's not just the blood.
Okay.
It's
Okay.
mRNA, DNA, and protein. So when people say, I didn't get an mRNA shot, sure you did. Every shot since 1934 was an mRNA shot. When did we get our first cases of autism and myalgic encephalomyelitis? Call it long COVID, call it chronic fatigue syndrome, call it, when did we get that? 1934, chapter 5 of our first book, Plague. You see, those have been censored away from people because your veterinarian would have been told the truth. And all I'll tell you is that MMR5, and this is from both the Gotti paper and the work of the beautiful hematologist, that's a blood scientist, Teresa Deischer. MMR5 had live equine infectious anemia virus, along with a whole bunch of monkey cow, and all of this was published in the scientific literature. SARS-CoV-2, part monkey, part HIV. It's not a spike protein, folks. It's a lipoprotein. We're lipid bilayers. This is why glyphosate matters. So you see, when you don't know the language and you've never been taught, sure, horses have thousands of pounds on skinny little ankles. Why do you think you have to shoot them when they break their leg in racehorses? Because they will never heal those bones because of the level of inflammation. They will never heal those bones. So the thing to do is the humane thing to do is to sacrifice them, is to shoot them, because but humans, they're shooting you with Dupixent, and that may well be the humane thing to do in some of these cases of what they've done to people. But we don't take the most vulnerable and the sickest and kill them because Obamacare said you can't have medical care after you're 75 years old. Remember, that was Obamacare. When was that? 2015. So the years matter, or 14. So you had to put the propaganda. So all your medical literature is literally propaganda, like that commercial. And even your veterinarians don't know the difference of a biologic, the definition. And again, it has a lot more to do than blood. Every shot had mRNA. And again, that was published and presented in Vaccine Court by me and Dr. Rossetti in 2014, 15. And what did they do about it is the $4 billion that was paid out of the tax on every injection. I wonder if there's still a tax on those biologics. Sure, they're biologics. They're synthetic. They're antibodies from what? Cow, pig, horse. So yeah, they took all those things they could no longer give and call them vaccines because they were liable. Because when you have cow, pig, horse viruses in the needle and you didn't clean it up and you injected it, then you caused not only atopic dermatitis, but a number of other deadly diseases. Again, asthma is not COPD. COPD is, they're giving albuterol. So we're literally addicting our kids and things like that. Chronic obstructive pulmonary disease is not emphysema. What did your government do? They lumped it all into one: emphysema, asthma, and I forgot what other diseases that were lung diseases, like various forms of cancer. No, they're not the same, and the molecular biology is different. And that's why we need to teach the doctors and the people. Nope, that's ding, 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 that's criminal fraud. Have some fun. Go ask your doctor. You can make a lot of money following malpractice. I'm just saying, because, well, you'll get the doctors out of there, or you'll encourage them to learn. To learn. And so if we can encourage them to learn, we win.
That's my thing, is I want them to learn. I want them to keep up with their studies and really learn about the body, not just what they've memorized and purged years ago. And then they go to these conferences and are fully funded by Big Pharma. So
And they're being lied to.
Yes.
ASCO, American Society of Clinical Oncology. God did not make oncogenes. There's no such thing as an oncogene. God made protection in all mammals. We don't lay our eggs in the sand. We make GLP, snake venom. The snake needs a fang. Don't help him. Don't have it your way. Don't inject. So that's the first thing. Do not inject anything. And an injection is the Implant Biosciences. That would be the Leidos, Leidos. That's at your airport under TSA. So you are injecting the bioweapon through energetics, not through low-level lasers that are healing for you, but they detonate the bioweapon that they wish to activate it as if you injected yourself. Don't
Golly
put your
day.
face in the screen. Don't let them. So you have eye injuries. So you're taking Dupixent and you go through the airports and you're an athlete, let's say. Those young men and women look like athletes. They're playing beach volleyball. Why are athletes being injected and forced to be injected? And so then they're treating that, and they have no idea that when they walk through, Leidos was the contractor, the agency, the government agency, not your government, the contractor, the hired gun from your National Cancer Institute. When I left in 2001, Judy Nolde, I'm sure that owned all the patents. So again, the problem, this was always about cancer. There is no such thing as turbo cancer. And you don't stage a cancer like you stage a house. You don't make it look prettier than it is, folks, or worse than it is. And we taught that this morning in with Dr. Michael Karlfeldt. I'm coming to you live from the Karlfeldt Center, where I have to come and heal myself with the frequency medicines, because again, I made all these drugs. The old drugs work, and at really, really low dose. This is what we did in Genius, GENYOUS, all the way up and down Canada, the best marine biologists. Can we take things and use ways to heal? And what is your FDA and corruption? We were saying that earlier. What is the FDA? It's not the Food and Drug Administration, but that's what's on the wall. It's the 1906, I think. You can correct the actual, maybe 4. Food, Drug, and Cosmetics Act. Oh, you mean there was no administration? No. And between the time they killed John Kennedy and the time they killed Bobby Kennedy Sr., you had 5 years. So what did the evil administration do? The CIA? The only bat cave in Reston, Virginia is the CIA. So how did we get a Ebola strain from Reston, Virginia? Well, we made it at your National Cancer Institute. We made a cell line and you called it a vaccine. And again, immunization is what the law requires. Can we do it? Absolutely we can. And that's why I bring it up, so that you're educated and your doctor's educated, and they find a different way. So let's find out some other commercials. Let's show the next one so we can talk about Ozempic and snake venom. No, you've got protection all the way back to lizards. You're good.
Yeah. And this is a popular drug. So let's take a look here.
Yes, I'm on Row. They say GLP-1s for weight loss is a shortcut. It's not, it's science. After kids, it's the medicine my body needed. GLP-1s helped me lose 31 pounds. One app to hit my goals. This is healthcare. This is Row. I'm Serena Williams, and I'm a real Row member. Yes, I'm.
So she's a real Row member. So notice what she's got there. It's not health care. Having children and gaining weight and losing weight naturally by getting the essential amino acid tryptophan. Where do you get that, birds? Tryptophan, chickens, eggs, turkey, all those things they killed and culled, eggs, other immune. So, okay, you're an athlete. You're Serena Williams, and you gain weight after you got fat. Now, number one, as an athlete, and oh, by the way, her sister died from these Sjogren syndrome is absolutely vaccine in HTLV1. We know what these syndromes are, and we've worked with them since, as I mentioned, 1980. I'm pretty old. Okay, so she's a member, row.co/Serena. Oh, she's a member. So think about everybody. I'm going to get in a PMA. I'm going to sell what it doesn't matter what it is. Any of these things where you're selling. Why don't even we just use something like X39 patches? Well, okay. So and stem cell patches. Do these patches have value and function, and can they help? Well, yes, they can. But you get in network marketing. That's the word I was trying to think of. You get in network marketing and you're an affiliate, and your whole job is to sell it. So she's just a salesperson. That's not health care. And pregnancy and childbirth is not a disease. But again, we're in a society, and I'm just going to go back to tennis in the age of Andre Agassi, another tennis player. Or how about Arthur Ashe? Oh, Arthur Ashe died not of AIDS, but of the treatment of contaminated blood, and he was a fierce advocate. So that all the way back in the 80s, Tony Fauci, he didn't lie. He said, in order to get HIV and therefore AIDS, you had to be a gay man, an IV drug user, or a prostitute. Okay, well, she's not gay. She's having kids. Arthur Ashe was a fierce advocate for medical freedom and a black man for blacks in sports. He's not a gay man. And who was Ryan White? A child. That's why that last ad had people. No, they're not people. They're children. And there are different laws. You're a child until you're 21 years old. You're a child until, to the government. When I did clinical trials, you were a child, and I had institutional review boards who had to make sure I didn't lie like this, But, did she lie? Well, no, she had no, it's not science. It's science. It's fraud by Abbott and the other people who gave her sister and her HIV infections and Arthur Ashe. This is all HIV. It was synthetic.
Really?
Yes. There's no such thing as Lyme disease. It's HIV. It's a co-receptor called GPR15. And all you have to do is look it up. So
are you saying
HTLV1,
she has
she has HIV. She harbors
and that's why
HIV.
she's gained weight? Or
Well, no, she had kids. She told you that.
okay.
Everybody that gets pregnant has kids, but hey, we want to, and she's an athlete, so that means she's been heavily injected. Oh, so did she get some injuries where she couldn't lose weight because she got injected with all those COVID shots? It killed her sister. I don't know. And all the shots since 2009 were COVID shots. How old is that woman? I don't know. She's not a bad person. She's out there making money. She's out and it's network marketing. So I wanted to show you the two commercials because I wanted to show you the dichotomy. Everybody thinks, oh, it's natural. No, that is not natural, and that is not healthcare. And it is not, it's science. And we learned how to synthetically put 3 different HIV GP glycoprotein 120 and let that surface unit envelope spike sneak out of a synthetic phospholipid bilayer, human cells, phospholipids. And then we put a little gamma retrovirus spike protein called syncytin peptide. Syncytin from our God-given HERV-W, human endogenous is our X chromosome. That's the WXYZ, because all the way down to protection, that's the one that's syncytin. The implantation is where twinning occurs. So in vitro fertilization will always be murder. I'm sorry. Get over it. Can't do it. It's against God. Conception is life. Our beautiful Dr. Carrie Made and those beautiful pictures of the light. You mentioned the light. We're light beings, functional, and we can show a product of that. So yes, there are, so she's there with row.co, and we'll look at it again. And all she's saying is lose weight. Well, those drugs also, none of them were validated. Bless you. None of those were validated. This is a clinical trial. And so you see, when you're in row.co, it's a PMA. You're not protected by a private membership association. Quit your Costco membership. You get a tax, you get a deduction in price because it's a private membership. So you're paying that money to poison yourself. And I guarantee you the food in those stores is poison. And I've been saying this for the better part of 10 years. And if I'm wrong, why does nobody ever say one word or prove me wrong? Because they can't. All they can do is shoot the messenger or attempt to try to censor me some more, which I honestly don't care about, because I only fear the Lord, and I am never going to stop talking. That's why I sign our book. I sign our book Ending Plague with Ephesians 5:11. Not only do you not participate in things of the darkness, the cult called scientism, it's not healthcare. We've never been sicker in all our lives. America was built on peanut butter and jelly sandwich. Now you can't have a peanut on an airplane without anaphylaxis. That's not true. It's a lie. It's not true. I dumped a whole bag of peanuts on an airplane and peanut butter. And I sat right there with my cardio miracle, and I'm just putting that on an apple, a whole food. And do you know, not one person on that plane said one word? You had to believe that lie so that they could put all that synthetic crap and all those pretzels and all those, so they could take away the only nutritious thing you had on most of these airplanes. It's sick. You can almost not drink anything on these airplanes. Everything is loaded with glyphosate. So it's a problem. And everything, it's, natural flavors. If it has a carbon in it, it's organic. By molecular definition, by my Ph.D. That's what your FDA goes by. So natural flavors are only the molecular part, but that's synthetic, and you can't, sure, it tastes like lemon, but you can't do it. You want real salt, you want real food. So everything they're saying is a lie. So I showed you the two commercials so that you could see, we're listening to an athlete. Really? You're listening to this woman who she gets to live, but we couldn't. She I guarantee you she didn't get shot. She got the control. She got the saline. So they all tricked all these innocent children who want to play sports and be just like her. You can do that. You can do that. You can be just like her. She earned everything. She worked hard. Yes, we can. But she also didn't get poisoned like we did. And she also was part of the control part of the clinical trials, like every other athlete that didn't stand, like people like Aaron Rodgers or people like Tom Brady. A lot of our doctors just quit because they wouldn't poison their patients. But that's not okay. That wasn't okay either. You can't quit on your patients.
Yeah, I wish that was true around where I live. I actually know doctors who where, like, one ENT, he set up a clinic to give those mRNA injections, the COVID injections, and then to make sure everyone got boosted too. And my whole thought was, you're an ENT. Why are you doing this? So
Because we let them.
yeah,
Because we let them, and they made a fortune. I'm going to get
yes,
me. I
they did.
literally sat in a restaurant with somebody next to me at the booth who said, I'm going to get me one of them PCR in Carlsbad, California, PCR machines and go to Qualcomm Stadium. Oh, how many people died at Qualcomm Stadium from those initial shots? Think of Bree Dressen. Think of some of these other people. Yeah, I'm going to get me one of these PCR machines. I'm going to do fake tests. The Q-tip up your nose is rape. So all of you who say, I didn't take those shots, you're not holier than thou. Yeah, you did. If you got any shot, or your grandmother or anybody else, or you ate, I was going to say contaminated, or you're vegan, that's against God. Get over it. I'm sorry, there are 9 essential amino. It is. God didn't make people vegan. He made everything for food, and we were given dominion over the animals. Whose fault is it? Ours. So again, that clinic, go to that doctor's clinic and file malpractice. And in that case, I would file criminal charges. And we're coming for them. I mean, you can run, but you can't hide at this point in time, because, Christ Jesus is in charge.
It can't
And
happen soon enough. So
yeah, can't happen soon enough. Why don't we play it again just for a few
okay.
seconds, just to see her, since we walked through it, because she said even less than the old people.
Yes, this was very fast. So
Yes, I'm on row. They say GLP-1s for weight loss is a shortcut. It's not, it's science. After kids, it's the medicine my body needed. GLP-1s helped me lose 31 pounds. One app to hit my goals. This is healthcare. This is Row. I'm Serena Williams, and I'm a real Row member. Yeah.
I'm a real Row member. Sure, you're all members of Costco too. So you're poisoning yourself, and you've been lied to. It's a shortcut. Oh, it's a shortcut. No,
yeah,
in a lot of cases, these people that are so tremendously, your fat holds your nutrients, your fat holds health, fatty acid oxidate. You're getting fatter because it's not food, and it's poison, and fatter and fatter. The people that need this, they do need it, but on a foundation. We cannot have these people walking around that have absolutely no life at 400 pounds in one of the most important groups, because you're getting no nutrients, 9 essential amino acids. Again, your doctor better know how to name them. You want to know how GLP is made? It's from tryptophan. You want me to show you, and we've done it, we taught it in a class about tryptophan. So you see, again, these papers came out, the review articles that are large meta-analysis of all the data of all the illness in the world. The review articles are telling you the truth if you can find it. The studies, any other study, I mean, they're just criminal fraud. So you see, in the first Trump presidency, he had to learn all this the hard way with criminal Alex Azar, and Deborah Birx. Why is she still on TV? Changing from Scarp Lady to say, oh, and we've learned so much about long COVID, was started in Los Angeles, Serena Williams, in Los Angeles in 1934. Actors, athletes. Oh, so how about the crimes committed by the medical communication, the healthcare she just named? How about those files and those records make Epstein files look like Pollyanna? And who has them in their entirety with unredacted emails, and who have fought all the way from 2007, 8, 9. This always was 911. This always was. We've got to stop the true healthcare because, we know the liability behind these shots since, okay, just make it the 1960s, the fraud in the literature, the first cases of HIV, our friend Lenny Horowitz. Oh, why did we have AIDS and Ebola in 1963? Again, the CIA
Yeah.
is your criminal organ. That's not healthcare, folks.
No.
It might be health if you don't fear only the Lord. It might be health to you if you want your freedom in a manipulated science or
Yeah.
society. It may be help to you, but we do and we can teach how to use these at the lowest doses possible, but we cannot have them sold in these network marketing companies. I'm sorry, if you don't get educated in how to do this, and this is why we've spent so many years on our cub, because these sales forces better know the government will come after you in your PMAs. You aren't Robert O. Young's in jail right now, not again. But Peter McCullough's not. But Peter McCullough's practicing without a license too. And we can just keep going through these commercials. When your Lord is someone other, your idol, these sports idol, Andre Agassi, image is everything. Well, in our country, image became everything, and it was all a lie, and now we've got a real problem because
Yeah.
the liability, this is my friend Del Bigtree and on the High Wire a month or so ago, he's like, I see why Jason Chaffetz does this. Oh, Jason Chaffetz, he was this congressman from Utah. And in 2017, March 31st, when every doctor heroes like Zev Zelenko, late great Tony Bark, late great Jim Meehan, late great Zev Zelenko, he's still alive, Dr. Noenschwinder, Dr. Jack Lyons Wiley, we all sat, Bobby Kennedy, Del Bigtree, we all sat in Jason Chaffetz's office when he was the head of the House Oversight Committee. And he said, we showed him everything I've told you and so much more. And what did he do? He quit. And now he's on TV. I mean, why aren't we the people upset about this?
Mm.
Why are we the people attacking the people trying, the statesmen, Trump, Kennedy, and others in that administration? Why are we attacking them when we don't have an understanding of the deepest? Lean not on your own understanding. Don't listen to a sports personality tell you to inject yourself, because then you're liable. When you have it your way, there's only one God and it's not you. And this is where we are. We need Saul to Paul conversions. That's what we need. Saul, the medical deities. Remember, the medical deities. And Hillary Clinton told you this at the NIH Criminal Center, standing right there with the head of the center, John Gallen, with the NIDA, the drug enforcement person, a Russian named Volkov, Harold Varmus, Nobel Prize for oncogenes. Nope. God didn't make oncogenes. You're wrong. And, Tony Fauci. Hillary was right in the middle, Secretary of State. And who was she talking to? She was talking to scientists, State Department officials. Did she say medical doctors? No, because they're not liable. So now you can take these biologics. Sure, they're biologics, but I don't inject cow parts. But we did, because that's what the word vaccine means. Vaca is cow.
Mhm.
Cowpox worked against smallpox because you developed so all of the pandemics, see, once we understand this and we never inject ourselves again, either by this kind of bioweapon, the 5G towers, get them down. They went up quick, get them down quick, get them
That's
down
a
quick.
whole other,
It's
yeah.
a whole other show, but again, once we educate, and I know we come up on an hour, so you don't shortcut healthcare. I mean,
No.
her words are very specific. She memorized that. Obviously, she's a performer, so she does a good job in that. But again, after having children, she just wanted to quickly lose weight. Instead of doing it the right way by eating nutritious food, getting nutrients in her body, and her children's body. Those will hurt her children. Those will hurt her children. But I hope to God she's not, and pray to God she's not breastfeeding these kids.
Oh, gosh.
There you
That
go.
is another thing to think about when you're a woman. But see, this is why it's important to understand why the faith in God goes right alongside what's happening in the pharmaceutical arena. This is pharmakia. The Bible warns that, and God's talking to a nation when he says, you have seduced the world with your magic spells, like magic potions, which is sorcery, which is the word pharmakia in the Greek. So, and that's where we get pharmacy from.
Right.
So that's why it goes together. And Dr. Judy, you're awesome to take time. I know you're traveling and you're busy, but to educate us on what we're seeing on TV and to really break it down. I mean, I hope people were taking notes. If not, go back and watch it again and understand what these drugs are and what they do and the dangers. Also, Dr. Judy, you have mentioned ArcHub a couple times. And it's a platform of learning. It's an educational platform where you can
I like
go.
to call it a hub.
Okay,
Because I'm not going to jump off a platform in front of the train.
Yeah.
And so we have channels on that hub so that you can get educations in these places. And I like to use the hub because spokes on the wheel is how we've cured these. We've developed these curative strategies. We've got this. We've done it since 1991, my PhD thesis. Magic Johnson is fine. It's not that he did, and what he actually did was all a lie. So you got psyop, get over it. So the hub there, when one spoke is broken, the wheel will be lopsided, but you can still come back in that systems biology approach. And we can have enough big data to actually personalize and get the foundations down to a cost we have. So we can't educate folks if they don't want to learn. So we bring this in a lot of different ways. Dr. Carlfelt was on this morning with Robert Scott Bell, and these are practitioners as well as scientists. They have PhDs as well as experience. You cannot be an expert without experience. I am not a researcher. I'm a scientist. A researcher is somebody who goes to the library and reads the lies. A master's degree is a lie. Robert Malone does not have a doctor in science. And that was easy. He put it on his CV in 2022. And all he did was drive and meet him and ask the simple question, who's your daddy? Because it's clear it wasn't Jesus Christ. And so it broke the ice, but we could have a conversation. And at that point, I could understand that he was completely captured and had been since the 80s. You're my age. I'm 67. Why don't our CVs, our curriculum vitae, that's what you have to do if you work for the government. It's not a resume. It's not a commercial like we're looking at. It's your curriculum vitae. And you have to keep your life's work longer than your tax records. That would be forever for any person. And we've got every bit of that data. So once he's doing a great job over there at ACIP, because now he's no longer afraid of the repercussions. It's brutal what he's undergoing. So can we bring people closer to God by simply having those conversations? Well, yes, that's what Charlie Kirk was all about. And so, when Christ comes again, every knee will bow. And our job is to make sure it's not the hard way because, our God's not a pansy.
Right.
Sorry.
No, he's
And he
not.
doesn't like women and children being hurt. You might as well, Matthew 18:6, throw a rope around your neck and drop it into what was the millstone, I should say, around your
Millstone
neck.
around your neck.
and drop into the oceans. That's how deep you're going to have to go into that hell. So, it's the women and children. Orphan, you're not an orphan until you don't have a father. You're never an orphan, because you can always, 70 times 7, you can always come back to having Jesus as your Lord and Savior, the Lord of your life. And that means having the courage to get educated. And that's why we set up the Arc Hub again. I mean, that it was, again, our companies all got slaughtered, and you couldn't do this from 22 to 25. Well, we're not going to give up, and we're going to put the education into the grants that it will be required to get those educations. And Bobby gave it to us last week with Maha. He said, yes, medical schools are going to teach nutrition. So our Cubs got a head jump. We've been doing it a long time. We'll have the great Dr. Lynn Lafferty in there. We've got for the eye diseases, if you happen to take some of those things in your eye, we got beautiful Dr. Nanda. She's also on the hug. We got Carrie Madej. And we teach these classes as we can, but we meet together and we develop the protocols and allow you to personally. We give you full informed consent. You can have the needle if you want, or you can have the informed consent. And I'll give you, it does take courage, because I'm going to give you an oral form of an AIDS drug, because hey, they work, and we developed them. I'm going to give you a low dose. Fenbendazole is murder if used the way these protocols are using them. I'm sorry, Joe Tippins is a criminal fraud. I'm sorry, and I'm going to say it because he's being paid by Merck and Merrill Lynch.
Maybe we
Oh,
can talk about that when you're ready to talk about
yeah,
fenbendazole. But
I
we've
will.
run out of time, but I want
Okay.
people to go to archhub.io and go look for, what's the name of your, tell us how people can find you there, Judy.
Well, there are channels on our Cub, so all you have to do is go to therealdrjudy.com. That's embedded in the website.
Okay.
That and then just look and see what we teach, because there's only two things. The only thing that it belongs to me. I'm not a product. I won't sell a network marketing. I don't sell anything. I develop the science of the products. If the manufacturers will humble themselves, and they do, and do the experiments I ask them to do. And so that's where I am on our Cub, therealdrjudy.com, or at Real Food Knowledge, RFK. My sister-in-law Donna's very clever. Johnny, my brother's wife. RFK, Real Food Knowledge, because that's what we're teaching you. What is real food? What is real food knowledge? And that's how you get health care and wellness, real wellness.
Thank you, Dr. Judy. We'll be back in a couple of weeks to talk about 2 more, or 3 if we can fit it in, different
And
prescriptions.
if anybody would like to suggest this a commercial, if there's
Yes.
something you want to explain, so have some fun. Don't put your head in the sand. Watch the
Yes.
commercials. Watch the
Send it,
commercials, because they're lying
Send
to
us
your
emails
children.
or commentaries on any of the platforms you see this on. I'll check it in a week. Thank
Okay.
you.
Thank you.